So thank you very much for coming, everybody. I'm Al Queen, co-chair of the Ottawa Health Coalition, and I'm just going to introduce the evening quickly and pass it over to our moderator, Jack McCarthy. We usually read an equality statement when we start our meetings. Essentially, we just want to be sure that everybody feels that they're welcome here. Everybody, all peoples of the world, and that we no doubt will have differing opinions on some things here tonight, but we ask that everybody respectfully expresses those opinions. So just quickly why we're here, aside from the fact that we have an election coming, I mean, we advocate for strong public health care, and we've had concerns, especially over the last decade or maybe even 2 decades, about the erosion of funding for our public health care system, and the consequences of which has been overcrowded hospitals, long wait times. In long-term care, we have 34,000 people on waiting lists at the moment. So there are problems that we need to address, and basically the position of the Ottawa Health Coalition and the Ontario Health Coalition is that it's time to rebuild, it's time to reinvest in capacity and restore services to meet the needs of the community, including doing a really good assessment of what is needed in the community right now. And so that's the basic assumption with which we've organized this meeting tonight. We want to hear from the candidates about how they're going to address those fundamental issues. And I'm not going to say a heck of a lot more about it. I'm going to let the folks here do the talking. And I just will say first off, though, that is there anybody in the room who has any difficulty with English and would like to have things perhaps from time to time translated into French? We don't have the services of the official translators in the room with the earpieces and that, but we do have someone here who's volunteered to help with any whisper translation, as you would call it, I guess. Is there anyone? Because she'll put herself close to wherever you are, and if there's more than one person, we can kind of bunch up in a group. So I guess we're good to go. All right, so I'll give this over to Jack McCarthy, who's going to take care of us tonight. So Jack retired in 2016 after 27 years of service as Executive Director of the Somerset West Community Health Centre in Ottawa. During his tenure, he oversaw 2 major capital projects and assisted in developing a range of community health programs tailored to the needs of vulnerable populations. Food security, affordable housing, support to refugees, and harm reduction programs are some of the issues that he has been passionate about over the years. His voice on healthy public policy issues has been heard at local, provincial, national, and international forums. So I will give it over to Jack. And I'll just mention quickly also that we have some literature in the room if you haven't already seen. And I'll talk about that a bit when this wraps up tonight. And some of our initial questions tonight will come from leaflets that we've prepared, especially for the election, issues that the coalition has decided really need a lot of attention. So I'll turn it over to Jack for now.
Thank you very much, Albert. So before I go over the format we're going to use this evening, it's going to be my pleasure to introduce the folks up at the front here, candidates who are running in various ridings in the Ottawa area, people who will be participating in this forum on healthcare. So to start off with, to my immediate left is Joel Harden, the NDP candidate for Ottawa Centre. To his left is Marie-France Lalonde, Liberal candidate for Ottawa Orleans riding. Stuart Ryan, candidate for the Communist Party of Canada, running in Ottawa Centre. Mark Snow, Libertarian candidate for the riding in Nepean. And Raphael Luis, none of the above party, who will be speaking as well. So we welcome all 5 candidates to this forum on healthcare. So the format we're going to use this evening is going to hopefully be smooth and interactive and engaging. And it's going to start off with, we're going to give each candidate 2 minutes to make an opening statement of their party's platform on healthcare. Then I get to ask 4 questions. Some of these questions have already circulated in the Ottawa Health Coalition flyer promoting this forum. Each candidate is going to have 1 minute to answer the question that I put to them, and we're going to have the 4 questions go to all of the candidates. And of course, there can be some opportunity for some people to rebut some of the comments that they're hearing from their colleagues in the front here. Then I throw it open to the audience for questions. Each question, again, is we've asked people to really cut to the chase with their questions. We have 1 minute. We want to provide an opportunity for as many people as possible to engage. And candidates will have 1 minute to respond to the questions coming from the floor. And at the end, we'll close with each candidate will be given 2 minutes for a closing statement. And that should take us to, a little after 9 o'clock. Anyway, that's the plan for this evening. So without further ado, we'll start from my immediate left and we'll move right across the stage. I'll throw it to Joel Harden, from the NDP Ottawa Centre candidate, for his opening statement. Joel.
Okay. Thank you, Jack. Is that okay?
Yeah.
And thank you, everybody, for coming. I want to thank the Public Service Alliance Canada for hosting us here. And I want to thank the Algonquin peoples of this land, who are the Indigenous folks of this land, for welcoming my ancestors and welcoming us hundreds of years ago. And as we talk about healthcare and looking after each other, I hope we remember that within the framework of the treaty framework that our nation, Canada, and our province, Ontario, agreed to. So here's what I want to say in my 2 minutes beyond what I just said. We're at a historic moment in our province, and I know you're used to politicians talking in hyperbole, but here's why I know it's a historic moment. We have seen the 2 largest political parties, who attract most of the mainstream media attention in this province, over the last few days, thrashing around like wild beasts. And both of them have one thing in common. They have no official platform costed that they presented to the electorate. Doug Ford, rather like another government we know, is issuing policy statements by tweet. The Liberal Party presented a budget to the people of Ontario that the Auditor General has said is filled with dodgy accounting and underinflated budgets, particularly in its capacities for energy. So what makes my party unique is that we have gone to the people with an adult conversation. And that adult conversation begins with fair taxation. Fair taxation, which will ask the wealthiest people of our province to pay more so we can rebuild our crumbling public infrastructure. Our hospitals, our schools, the people in the street who do not have access to affordable housing or addictions treatment. We have an opportunity in 2 weeks to elect a government that at the moment offends the powerful. And that is making me a very happy person, as of right now. In 2 weeks, you have an opportunity to vote for a government that cares about the many and not the few. And that's the framework I want to situate my position in tonight's debate.
Thank you, Joel. Now, Mary-France Ladon.
Bonsoir tout le monde. Good evening, everyone. First of all, I want to say thank you. Thank you to all of you for being with us tonight. C'est vraiment un plaisir de vous voir. I also want to welcome every candidate that are here. So my name is Marie-France. I am the candidate in Orleans, but I'm here on behalf of the Ottawa caucus, our Liberal friends who have been part of your community for several years, building our healthcare system together. We believe that we deserve the highest quality healthcare when and where we need it. We know that, and I have to say as a former social worker working in hospital, our population is aging. And we have to address the issues that are upon ourselves. As we know, we need to relieve any stress, and I've worked with families and looking at discharge planning for several years. The stress, the amount of resources, and also the component of empathy that sometimes family and finding the right place and the right resources for those families. Each year we've invested in our healthcare system, and certainly our 2018 budget is of that essence. We're going to continue to invest, build our hospital, invest in our wonderful healthcare provider, and I'll have more to say as we elaborate throughout the evenings together. Merci beaucoup.
Thank you, Marie-France. Now, Stuart Ryan.
Thank you, Jack, and thank the Ottawa Health Coalition for organizing this forum, and thank you all for coming out here to challenge all the candidates with their positions on healthcare. My name is Stuart Ryan. I represent the Communist Party in Ottawa Centre. I've lived in the riding since 1979. I worked for almost 33 years for a union at Carleton University, Canadian Union of Public Employees Union, and I've been involved in the labor movement, peace movement, international solidarity movement all those years. And since I retired in 2015, I've been a part of the Ottawa Health Coalition. Our party's platform, called Demand the People's Alternative, has as one of its pillars a call for universal public and social services, and that's including healthcare. But for the last 28 years, since 1990, each party that's been in power, be it NDP, Liberal, or Conservative, has been implementing the neoliberal austerity agenda. And the effect in healthcare has been enormous. Ontario now has the lowest per capita funding of hospitals in the country. And we see privatization of hospitals, home care, long-term care, increased costs, and cut services. So we demand restoration of hospital funding, put it above the national average, open up hospitals that closed, and universal public services such as healthcare, dental care, pharmacare, and stuff. So we'll talk more during the debates. Thank you.
Okay, thank you, Stuart. And now, Mark Snow, the Libertarian Party.
Good evening. My name is Mark Snow, and I'm with the Ontario Libertarian Party. We're running 117 candidates in this election, almost a full slate. Excuse me. Tonight I want to talk to you about all the problems that these three candidates just talked about, and the Communist Party actually reiterated. The problem is not with funding. There's enough money in the budget. That's not the problem. The problem is the bureaucracy that's behind it. Right in this own little report from the Liberals' own budget, $28 billion goes to all the LHINs, all the 14 LHINs in in Ontario. Eastern Ontario LHINs asked for $2,600,000. They got 2/3 of that to operate the Eastern Ontario LHINs network. The problem is not with the money. They're adding $6 billion. The Liberals are adding $6 billion more this year to the budget. Government cannot fix the problem. They're throwing money at it. They will take the money, that $6 billion, which is borrowed money, and they're going to create 5 new bureaucracies. And that means only half that money is, again, going to get down to frontline services. That is the problem. We need the people of Ontario to have the power, choice, and control over their healthcare services. In Ontario, if I could give $1 billion to Eastern Ontario LHINs, I would make Shirley Mosley very happy, first and foremost, if you don't know Shirley Mosley. Secondly, I could hire 100 doctors, 1,000 nurses, 500 PSWs, buy 10 MRI machines, buy 10 CAT scanners, fund 1,000 bed spaces in hospitals, or subsidize 1,000 seniors per month, 12 months a year. With $1 billion, that's $547 million. There's still $443 million. That's the rationing that's going on. The Ontario Libertarian Party says the funding will be attached to the individual, and the individual can send that money to OHIP. Or if the individual wants to try private care, and I know there's a lot of people in this room that hate it. Matter of fact, he even brought brochures. We have this right now because these parties have delisted so many services. We have our parents that are paying out of their pocket. Thank you.
Your 2 minutes is up. Thank you very much. We're now going to go to our last speaker, Raphael Luis. Is that how you pronounce your last name? Luis? From the None of the Above party. Raphael.
Hi everyone, thank you so much for hosting this important event, and thank you for having me. It is a pleasure. And just to rectify, the full name of our party is None of the Above Direct Democracy Party, because we believe in putting the will of the people in government first. My background particularly is on integrative medicine. I've been working with the naturopathic medicine, integrative medicine. For several years, I've been delivering lectures across Ontario, although I spent a few years, over 10 years in British Columbia, where I learned how the integrative medicine with an holistic approach can help alleviate cost on our healthcare system, because right now Canada slash Ontario has the most expensive healthcare system. Of course, the delivery is lacking. So our approach is healthcare reform. Healthcare reform with an holistic approach that can, of course, reduce the number of sickness, reduce hospital beds, prevent illness, and by prevention, we can reduce the costs that the healthcare system is costing taxpayers. We can reduce those costs significantly, which would allocate enough funding through eliminate lots of bureaucracy in order to have enough funding for the healthcare system to deliver. And of course, at the core of our healthcare reform approach, we put patient first. Thank you.
Thank you very much, Raphael. Okay, we're now going to move into the second part of the debate format, and that's, I'm going to ask some questions, some questions that the Ottawa Health Coalition has put together. And just to put it out there, there's the 4 questions there will be, and one will be on overcrowding hospitals, one's going to be on long-term care homes, the 3rd question is about primary health care in community health centers, and the 4th will be about public-private partnerships, these P3 privatization as it relates to the new civic campus at the Ottawa Hospital. So the first question, and I'm going to go in the order, starting with Mary France, and then move to her left after that. The first question, and a bit of a preamble, while the optimal occupancy rate of a hospital is 85%, the Ottawa Hospital and the Queensway Carleton Hospital are almost always over 100% capacity. Dr. Andrew G., in a recent article in the Ottawa Citizen, said that we, quote, function within the confines of a beleaguered system. My question to the candidates, will you commit to increasing funding to build capacity to reopen closed beds, wards, operating rooms, and services in acute care settings? Mary France, if you could start off.
So the first answer is yes, definitely. We will continue, I would say, to invest in our hospital sector. You know, we know there are challenges, and you hear through the news, I hear through stories, as we heard in many aspects where it seemed like the system is just not happening the direction that you anticipated or wanted for. So our commitment is a reinvestment at $822 million. We're going to build new long-term care beds, and also we're going to work with our frontline staff. I come from an environment where interprofessional is very important. The role of everyone within the healthcare sector is important. And here in Ottawa, we've made those discussions, we had those discussions with each and every of those hospitals in ensuring that there is enough operating, that we have addressed the wait list and the new reality of our aging demography.
Okay, thank you very much, Mary France. Stuart, the question to you, will you commit to increasing funding to build capacity to reopen services in hospital settings?
Yes, sir. Of course we will. We want funding to be increased so that at least Ontario gets above the national average. We've had 10 years of cuts by both the Conservative and the Liberals, thanks to Drummond's report, which was a study put up by McGinty. The person in charge, Donald Drummond, was a former bank economist for TD Bank. So, you know, in fact, he came to Carleton and said he had written 3/4 of it before he was appointed. So we would do that. That's the reason, and the way we would fund it is we would double the corporate taxes they've been sitting on especially since the financial crisis, doing very well, while people's wages are stagnating.
Okay, thank you, Stuart. Mark Snow.
Madam Liberal candidate, I'd like to show me in this document here where you're talking about your $822 million, which is your estimates for April 2018-19. This is the problem. They talk about how they're going to invest. They don't. They grow the bureaucracy and cut services. Those service cuts are affecting us, are affecting my parents, are affecting you. The service cuts, they don't care. They delisted so many services in this system in the last 13 years that they've been in power. Only by the people controlling the funds will the system get better, because then the people will make choices, and people like these that are standing up here making you promises will have no control, no ability to change your funding formulas in an election year, make you promises, because you will control it. You will put it towards the services that you need, either OHIP or private services, and then you will own it. We become, as politicians, completely irrelevant and have no power. Thank you.
Okay. Thank you, Mark, and over to
Member your budget. Thank you.
okay, Raphael, to the first question.
Yes, we would commit to increase funding. However, when you look at the history of our healthcare from 2009 and up until this present year, there's been increased funding, and the service delivery is still lacking. So we have to have a systemic approach, also by increasing funding, also to regulate those funding, because if we increase funding, for example, from 2009 up until 2018, we spent over 10 or 15 billion extra in healthcare, but nothing has improved. Is not how or if we're going to increase funding, but where this funding is going to be allocated. That's the real issue in our healthcare system.
Thank you. And now, Joe. Put the microphone down this way.
Thank you for the question. So what we've committed to do, because we're engaging in a system of fair taxation, which will ask the wealthiest people in our province and the most profitable corporations in our province to pay more to our collective prosperity, is that we will immediately increase hospital funding by 5%, which is a $916 million investment. But our long-term goal, because we do have a long-term vision, is to engage in a 10-year capital funding project of $19 billion, because that is what we need. And the capital we intend to build will not be built on the public-private partnership model, which research has shown and the Auditor General of this province has shown only enriches the consortiums that build it. We are the party that believes in the healthcare workers of this province, and that's how we intend to build it.
Thanks, Joel. Before I go to question number 2, does anybody have any comments in terms of responding to either what your fellow candidates have said here? Marie France and
Yes, and Joel, I actually all appreciate our comments up here, but I just want to ask you, I know recently Mrs. Horvath did acknowledge a $1.4 billion mistakes in your costed platforms. So I'm just wondering how would that affect your commitment? What I'm saying to you tonight is that if you look at the footprint of Ottawa, we've doubled the Montfort. We've built a clinical care wing at the Ottawa Hospital. And I know that's why I'm looking at my note. New cancer center at the Ottawa Hospital General and at QCH. CHEO has a new emergency and an expansion. Royal Ottawa Hospital, brand new. University of Ottawa Heart Institute, double the size of QCH, the Queen's Carleton, and we're committed $1.8 billion for a new civic. Over above, we're saying we know there's a reality out there, and we need to invest in our people. We need to invest in our healthcare provider, in direct funding, in helping, taking care of all of you there.
Okay, thank you, Mary. Joel has a, then we'll throw it over to.
Who's asked the question, so I want to be able to respond.
Okay.
Well, thank you for the question. And because we have a costed platform released to the public, it can be scrutinized many times. We await the opportunity to do the same for your government because it is your obligation to release a costed platform to the province. Now, as to the very piecemeal various infrastructure projects you've outlined, what's important, what everybody in this room likely knows, is that under Kathleen Wynne's leadership in the province of Ontario, hospital budgets have been effectively frozen for 4 of the 5 years that she's been premier. And for the 15 years that the Liberal Party has been in government in Ontario, effectively, the Health Coalition has published this, $300 million has been taken out of our hospital systems here. That amounts to taking a hospital out of our community. So while I appreciate the piecemeal infrastructure projects that have been done and that they will help, our party is the party that will actually ask the wealthiest people, the people who tend to bankroll Liberal candidates and Conservative candidates, to pay more so we can rebuild our crumbling infrastructure.
Okay, thanks, Joel. Mark?
Joe, just one question. You say an extra $960 million, 5% that you're going to tax the people that actually pay taxes in this province and create the jobs. That's
We
one
all
question.
pay taxes.
We all do.
The second question is to you. In February, this mole popped up on my head. And then
Mark?
since then, I've seen the doctor twice.
Could I ask you to use the mic, Mark?
Oh, sorry.
Some
This
people
mole
back-
popped up on my head. I'm talking about the cuts.
Yeah.
And 2 more have popped up since. I see my doctor in March. I got my letter the other day saying that I get to see the specialist, not get a treatment, 10th of December. That's a direct result. And a lot of the people that are in this room are having that problem right now of the cuts of your services. Give us the money. Let the people make those choices and control the healthcare funding in Ontario.
Okay. Stuart, do you have a comment to respond to
I
this
have
question?
many comments, so I won't go. Okay, the investments in hospitals, you mentioned the Royal Ottawa, you mentioned the money for the Civic campus. Those are going to be P3s, and that means extra costs. The P3 at the Royal Ottawa, nice new building, went from 230 to 180 beds. And people, the lineups there are like that. I'm afraid that's going to happen at the Civic as well. So we have problems with that. And with giving the money to the people to invest, it's like charter schools. You're going to end up with money going to one hospital and the other is going to be dropped. People it's going to create more discrepancy and inequality in the services provided.
Okay. Thanks, Stuart. Okay, now we're going to go to the second question. And we'll start off with Stuart. You hold on to the mic so you can respond first. Okay, and it relates to long-term care, which has certainly been a hot topic of late. So, question number 2. A private member's bill was before the Ontario legislature proposing an expert-recommended 4 hours per day on average minimum standard of hands-on care. Is it working? Okay. The government prorogued the legislature. I don't think it's
Might be a switch.
Not on.
There you go.
Yeah, thank you about that.
Test?
No.
Like,
We're still.
Monkey mic.
yeah.
We meant to share a mic.
Okay.
We'll share the mic. There you go.
Okay, I'll try that again. Okay, so I'll run back and forth with the mic. So just again, question 2. A private member's bill was before the Ontario legislature proposing an expert recommended 4 hours per day on average minimum standard of hands-on care. The government prorogued the legislature, killing the bill after it had unanimously passed second reading. Given that there are an estimated 34,000 new long-term care beds needed in Ontario, my question to all the candidates, here is, are you committed to bringing a minimum standard of 4 hours care as a measurable and accountable standard and increase the public and not-for-profit capacity in long-term care? And we'll start off with Stuart.
The short answer to those questions are yes. And briefly outline that I have a friend who's in a private retirement home, long-term care, and she gets good service there, but she's looking to move into the public one, and the cost for that for her will be a lot less. And we need at least 30,000 spaces in long-term care, and for all the reasons before, it's better in public than private. I know that, you know, Senator Kirby, when he was putting up his healthcare platform for private care, just happened to own extended care.
Okay, over to Mark.
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 If you're not gonna
Yeah, I
use-
don't need Mike.
Well, no, Mark, well,
Okay. Oh, right, sorry, I'll give it a yeah. So, start my timer clock now. By the way, I like the analog clock. So, we can't commit to 4 hours of care because there's no money to pay someone. Even if they say that we're gonna do that, there's no money in the budget. LHINs and hospitals are held to a fixed budget, they can't spend above it. So even if these parties say they're gonna do it, unless they back it up with the money, it's not gonna happen. And you need to understand that. Saying, are you committed to bring 4 hours of care? Only if the money's there. I will 100% commit to that. You know why I'm gonna commit to it? Because your direct funding of OHIP for the Eastern Ontario LHINs with your own tax dollars, 100%, well at least 90%, will make sure that there's enough money. Like I said, $2.6 billion, $50 billion budget, 2.6 out of 14 LHINs. Do the math, there should be another $1.5 billion there. That exact $1 billion that I talked about, what's the cost? PSAC won't like this. It means getting rid of the bureaucracy, hiring more doctors, more nurses, more PSWs, buying more machines, buying more, opening more beds. I probably answered the next question, but that's what it's going to come down to. And the only way that will happen, these people won't make it happen. They want to grow that bureaucracy. They want to grow those government services. They want to add to the 5 layers above the LHINs that sucks from the dollars.
Okay, can we pass it over to Raphael, your response to this question?
Yes, of course, we will be committed to bringing a minimum of 4 hours, but also we have to look at a per need basis. If someone requires 3, 4, 5, we need to go case by case. And also we have to address the funding issue, where we're gonna have the money to support this long-term care, and in the budget we need to tackle legislation so we can allocate those finances to those resources so they can provide those care. So yes, we will be committed to that.
Here. This. Okay, thank you. Joel.
Thanks very much. We've committed in our vision for Ontario to massively address the long-term care crisis. We will build, over the long term, in that larger capital project, through public financing, I mentioned, 40,000 new beds to meet the crisis. But immediately our goal within the government's first mandate, our government's first mandate, is 15,000 beds. Because it's not fair that people who built this country are sitting, languishing on a list. And that applies to home care too. There are 2,800 people in this city waiting for home care. And while they wait, they risk a chance of falling and hurting themselves. And Mark, quite frankly, you are in the house of the PSAC. So I will remind you, the next time your plane lands safely, thank a bureaucrat who's unionized by this union. The next time you eat a steak and it didn't poison you, thank a bureaucrat that's a member of this union. No, sit down, I'm not done. The next time you languish on a bureaucracy, don't forget the firewall that survived Canada under the Harper regime. It was the Federal Public Service. They deserve your respect.
So our plan is very clear in our budget and soon to be released platform. So our budget talks about taking care of our seniors, or our people. That means that within the next 10 years, we will be committing 30,000 new long-term care beds. In the next 4 years, 5,000 new beds. And we've already released the Pearly and Montfort, in partnership with Rivera, will be building the first tranche of. When it comes to the 4 hours of commitment to, in terms of nursing, we agreed to do this. Definitely, we will be reaching this by 2022. And the reason why is because we need to build the capacity. We need to ensure that, as Joelle is saying, for building 15,000 beds, that we have the infrastructure in place and we are capable of having the physical human resources in place to take care. We're also looking at training, a better mental health, and also behavioral component for people with dementia.
Okay, questions? Now a chance to rebut any of the comments you heard. Okay, want to start off?
Just one question, Joel. You talk about making sure that you have those beds. Are you going to commit to hiring the people? We don't need the beds. They're already existing in Eastern Ontario. All the hospitals have empty wards right now. Commit to the people to bring the people in and pay for the nurses, doctors, and staff that is needed to do that. That's all I'm asking you. Are you going to commit to that, or are you going to commit to the program of building something? I'm not sure where you were going with that. And yes, I appreciate every government service that I have. I just want it better run with less bureaucracy and more frontline service workers.
Presumably you want it being run by robots, I guess. So the point of the matter is, Mark, at the end of the day, the NDP sees a much different healthcare system than you do. My partner works at the Children's Hospital of Eastern Ontario. They regularly have to turn kids away because they can't accept people into the resident room. The hospitals that I've seen, Mark, are full. And I've made the rounds to the entire campuses of the entire system and talked to healthcare workers themselves. So I don't know where these empty rooms are that you're talking about. Because the Liberal government that we've had in the province of Ontario for 15 years has starved the system. And I'm glad that they're engaging in various infrastructure projects close to election time to purify the record, but they aren't pulling healthcare workers who are getting injured and hurt in the course of having to deal with excessive staff workload. That's what happens. It's people who suffer, patients and staff. And under an NDP government, that will stop.
I was going to quickly say that we hear what we're going to commit to, but we don't hear how we're going to get things done. And right now, we're having a system that is running at full capacity, and we're not committing to expanding. What's my experience with healthcare in British Columbia, they're building more hospitals. They're expanding their emergency. They're expanding their palliative care. They're increasing their capacity, because if you're not increasing the capacity of your healthcare, it won't sustain the growing population. It won't sustain the aging population. We can commit billions, but if we're not increasing our capacity, we won't be able to sustain the system. And I would like to ask, when you're committing, how you're going to reduce all those? Thank you.
So as I mentioned, I was part of the healthcare system years ago, and I do remember the NDP government for the time in terms of bed closure. I also remember the cuts of the PCs, and that's what led me to want to be in politics, actually at the provincial level. So, you know, years ago, we realized that we were growing. There was an aging population. We also have currently more acuity in our system. People are living older, but also with different needs. And that's what's leading us to rebuild the entire system. We talked about hospital. Well, I'm in the East End. I've seen the doubling of Montfort. I've seen the increase in capacity at the Queensway Carleton Hospital, our investment at CHIO, our investment at the Cancer Center, our investment just recently at the Royal Heart Institute, something that the Ottawa Heart Institute University, something that we should be so proud of. Is there challenges? Yes. And that's why we are fully committed in working in partnership with our healthcare sector.
Stuart?
Mark's right on one point, that there are bids, they're available, but we don't have the staff to service them. There have been cuts consistently, cuts are continuing right now at the Royal, at the Civic Campus, the General Campus. They're cut right now because of the lack of funding for it. When we say funding, we mean funding people, frontline staff. And not only that, bring back in-house laundry services, food services. I remember a couple of years ago, the Board of Governors of the Civic decided, or the Ottawa Hospital said, oh, we'll spend a week eating the food that they're servicing their patients. Yeah. They didn't quite make it through the week.
I'm going to move to the third question. Again, the third question focuses on primary health care in community health centers. A patient's first contact with the health system is usually with a primary care provider. Rather than relying on private doctors' offices, this could happen in our publicly funded community health centers or Aboriginal health access centers, where patients can draw on the skills of a team of salaried health service providers, including, for example, nutritionists, nurse practitioners, dental hygienists, doctors, nurses, OTs, social workers, and the list goes on, all under one roof. So my question to candidates, are you prepared to promote and fund public primary health care in our community health centers in Ontario? And the first person is Mark to answer that question.
Thank you very much, Jack. If I understand the question right, are we going to promote and fund those? If the people have the money, we can do that. They're not getting the money now. That's why you're specialists. That's why all those people that he mentioned are lacking in actual resource time on the floor. The patient loads are high because they have cut all the frontline services and grown the bureaucracy from 902,000 in 2003 to 1.51 million public servants that have grown. And all that time, just like he said, the budget hasn't moved. So where did those cuts come from? Services. So anything that hires more frontline service providers, anything that provides any more help to the people, I'm for. Anything that grows the bureaucracy, I'm against. And the only way to do that is if the people control the funding and make choices, not the bureaucrats, not the politicians sitting up here. That's the power that you can have and stop them with your choices.
Okay, thanks, Mark. Raphael.
Back in the late 90s, I went to a meeting where foreign doctors came to to our country trying to get work in the healthcare system as practitioners, and it was a huge struggle. Yes, we lack human resources, a significant issue. And when I compare the system in the United States, they have a matching program. Foreign doctors come, and within a year or two, they practice. So that alleviates a huge burden. But we still lack a great deal of human resources, lack of doctors. I have friends in BC when I lived in British Columbia, they wait over a year for a hip replacement. And it's not that there's no specialist, it's that we must respond to the human resource, the lack of human resource that our system currently facing. And for me, living through this is a crisis that we need to address and resolve.
Okay, Joel.
Thanks. Well, I've had the really good fortune to meet with all the executive directors of the community health centers in our riding in Ottawa Centre, and it's been very revealing for me because what I've learned is how people make use of resources to treat some of the most marginalized people in our society. And I take my hat off to them because what they do in stretching a dollar to actually help some of the most at-risk folks, whether it be trans youth or queer youth on the street, whether it be Indigenous people or folks who are differently able with mental health challenges, is phenomenal. But they deserve a bigger budget, which is why we pledged to increase their budget by 5%. And the way we'll pay for it, Mark, is by making sure the wealthiest people in this province pay more in tax. 1% more if you make $220K a year, another 1% more if you make $300K a year, and 1.5% more for the most profitable corporations in this land. And we have other revenue generation mechanisms. Because as Ed Broadbent tells us, we need to have an adult conversation with the electorate on taxes. We are the only party currently sitting in the legislature that is going to the vote with that in mind. We're going to raise the money, we're going to ask the folks who have to share.
Okay, Mary France?
Well, certainly, this is a very good question and a very important question. You know, when you think about patient first and the access that individuals need in each of our communities, and I'm very happy to have seen the family health team being part of our new structure. We've seen numerous being built, being conceptualized and operating. We've also seen our CHC with capital infrastructure most recently. And I have to say, what we're looking now, and I actually, as a former MPP, I made the great pleasure of calling some of them to talk about the $330 million new investment for the retention and the recruitment of some of the employees. And we realize, as you said, Joelle, the challenges that they are facing. But being part of a multidisciplinary team is key. Having access to a nurse practitioner, an RN, an RPN, a nutritionist, someone that, a social worker, I should say, I'm a former social worker. But that dynamic, including a doctor, is all part of our healthcare integrated system.
Okay, Stuart?
I think this is the way to go for primary health care is the community health centers. For all the reasons that Joel outlined, servicing marginalized people or even others. I live in Centertown. I went to the Centertown Health Clinic to get on the list. Only be a year before you get in because they don't have the money. That's the way to go. In some way, our Medicare system was built on the doctor fee-for-services system, which and you get sent off to a specialist, and it takes a long time to get in there. I think a system where doctors, nurses, nurse assistants, social workers, and psychiatrists are working together as a team is the right way to go.
Okay, any rebuttal comments on this question of primary health care through CHCs? Joel?
Because we've knocked over 35,000 doors in our campaign, I've had the good fortune to meet a lot of people at the doorstep, and some of them work in community health centers. And I met a family doctor who's on stress leave right now with serious mental health challenges as he and his partner try to raise their son, because he is under the stricture of trying to treat people on the Ontario Disability Support Program with serious mental health challenges to process them and their medical needs in 20 minutes or less. And he cries at night, knowing that each patient actually needs much more, needs 30 or 35. And it was the repeated stress of having to go through that that made him go on stress leave. So I just want to point out to all of us in the room who are advocates for healthcare, that that's the hidden cost when we don't fund centers. And having talked to the health centers, I know they are stretching every dollar, putting people on and off layoff. So when I hear my colleague talking about the fact that investments have been made, and isn't it wonderful to see them, most of the investments my colleague is talking about are supposed to happen after the election. And people can't wait. The CHEO announcement is a great boutique announcement, case in point. People can't wait. People are suffering because of the cuts.
So that investment of $330 million actually has happened. It was part of our 17-18 and furthermore for 18-19, just for you to at least review and speak the facts in this event. So for me, it's very important that we're addressing those challenges. And you know, when you talk about marginalized individuals, when you talk about the issues, well, you know what? I'm very happy that we have committed further investment of $2.1 billion over 4 years to address the mental health and addictions. And we realize there's challenges out there. And you know, for all the great individuals that work in our healthcare sector, well, I commend you. I commend you for helping us every day take care of our most vulnerable, our seniors, people that have disability. This is extraordinary work that they do. And we're responding. We're listening, and this is why this budget's about taking care of people. It's about investing in the people with you.
Well, I heard my colleague earlier on is going to raise taxes to be able to increase the budget by 5%, but what I agree with my colleague Mark is that the money is already there. The problem we have is budget allocation, where the money is allocated. Is it allocated to the service delivery, or is it allocated to more bureaucracy? Taxing is not going to solve the problem, it's going to make it worse. And we're against taxing already. We're already paying high taxes in this country. Raising the taxes to increase the budget is not going to solve the problem. It's going to make taxpayers even madder, if I can say. But again, my colleague Mark is right. The money is there. We just have to eliminate some bureaucratic ladder so we can get the money to service delivery where it can be allocated without having to raise taxes. Because we're already burdened up to here with taxes. We should look at reducing taxes, not increase taxes.
Well, the working poor, working class people are overtaxed because they used to be, I remember one meeting with a Conservative candidate a couple elections ago, he said there was only one taxpayer. Well, there used to be two. There used to be the corporations that got taxed and the people. So what happened, the corporation taxes went from paying about 50% to now about 20% of the services. They're making billions of dollars. Just the other day we heard the Bank of Commerce got 25% more profits, but they're not paying their fair share. So that's why we are investing more on doubling the corporate tax rate, paying for the services that they need in order to make money in the first place.
Last quick comment before we go to the last question.
Quick comment, it's actually a question for my colleague Raphael that will inform my actual question. Who funds the None of the Above Party? Speaking of financing, where does your funding come from?
On primary health care.
It'll inform my question on primary health.
All I can tell you that we're not funded by any corporation. We're self-funded by private individuals that spend money on their own campaign. We raise our own funds. So for me, I self-fund my campaign out of my own budget. I don't owe anyone anything. If I get elected, I don't have to respond to anyone but the people who elect me to serve them in government.
And the same with the Ontario Libertarian Party. Our total budget,
You can use them like it's actually helpful.
our total budget is $85,000. We spend $35,000 on our campaign. We're self-funded. My whole campaign is coming out of my pocket. No tax receipt, no donation, no contribution. I'm here, standing up here because I care. They got $12 million of your tax dollars to fund their campaigns. We got nothing. We don't want nothing. As a matter of fact, in our platform, we're going to eliminate all political funding for any political party.
Last comment on this question to Joel, and then we got to move on.
I appreciate my colleagues talking about grassroots organizing. It would be useful to know if there are any developers or highly rich and influential individuals funding your party, Raphael. That's what I'm curious to know, because there's a lot of lawn signs going up in Ottawa Centre, and that money doesn't come from nowhere. Our party is grassroots fundraising for individuals, and we don't take money from developers, and we don't take money from landlords, and we don't take money from lawyers and influential consultants. It's grassroots people.
5 million.
And I have to say, we're not allowed to take money from unions. You should know that. The fact of the matter is, the fact of the matter is, what I want to know is at what point are we going to say it's time to make sure that the direct healthcare services are funded to the extent that they need to be funded? And there are people, Raphael, in our province that have a different tax system unto themselves. The Westons and the Thompsons, the two families in Ontario that are the richest in Canada, have as much wealth as 11 million people, and they park their money in offshore tax havens, and they avoid taxation. And your party may not want to hold them accountable, my party does.
We're going to move on to, we want to focus on healthcare here in the last question, because I want to move quickly through this, because I want to throw the open to folks here, and I'm getting a lot of nods. People want to be able to ask some of the questions. So the last question, again, generated by the Ottawa Health Coalition. Question number 4. It has been reported that the new civic campus of the Ottawa Hospital will likely be developed as a private-public partnership, a P3, the preferred model of the Ontario government for building new hospitals over the last decade. There are several examples of cost overruns, secrecy, corruption, decreased services, etc. in Canada and in the UK. Locally, the Royal Ottawa Hospital P3 experience is a warning that we cannot rely on multinational corporations to deliver public services. Ontario's Auditor General Bonnie Lysyk warned of the problems hospitals have encountered with P3 partners. So my question to all people at the table here, will you commit to stopping the public-private partnership P3 privatization of the new civic campus? Raphael, we'll start off with you.
Well, we know the money is there already, and if you can quickly rephrase the final question, because my colleague was telling me something.
Will you commit to stopping the public-private partnership P3 privatization of the new civic campus of the Ottawa Hospital?
That's exactly what the None of the Above Party Direct Democracy has been fighting for years, and our leader, Greg Vezina, is a pillar in democratic governance. This is a poison to our political system, privatizing public institutions, public resources. And we've seen, that's why my colleague from the NDP is saying that who is behind us, who is funding us. Fortunately, we have no wealthy individual, no wealthy corporation giving us money. That eliminate the fact that if elected, we will be conducting or leading into any corrupt activities. So we will not toward any privatization of our resources. And that's exactly the disaster we've been seeing in our education system. Now they're looking to privatize our healthcare system. So we will completely oppose to any privatization of our publicly owned healthcare system.
Thank you, Raphael. Joel.
Yes, we oppose P3s. And not just in the health sector. The second stage of the LRT that's going to be built here in this city, the first stage is being built with a P3, and the second stage is going to be attempted to be built by a P3, but an NDP government will stop that. This is something we believe in it because the P3 trick is that you minimize the immediate costs on your public ledger by allowing a consortium to build something. But as we see with the LRT in this town, funny, delays in construction happen. And the cost that gets associated and bumped down to the people is significant. So we have to get back into the business of issuing municipal bonds and provincial bonds and federal bonds again to do this the right way, to build things the right way. And last but not least, the Civic Hospital campus, almost 8,000 people in this community asked for it to be located at Tunney's pasture.
Yes.
And somehow the developers in this town got together with the mayor and they came out of a meeting with a different opinion.
Shame.
All the Liberal politicians in this city were part of that meeting. I asked the room, who runs Ottawa, developers or us?
So thank you very much for the question. So I can say that our party, we, the Ottawa Caucus, and I, believe in a publicly funded healthcare and pharmacare system. Every hospital, actually, that has been built in Ottawa is publicly owned, and the governance is a public board that's appointed through the community. You know, what we have seen with this model is that it brings predictability. It has brought a responsible way for its maintenance, and it has allowed us to actually invest billions of dollars to ensure that our hospital have the technology, that our healthcare provider lives, and people that needs hospitalization are part of a system that reflects a 21st century model. And so we have We have doubled, and as I said, the Montfort, we've worked very hard. That's it, I'm sorry. We've done a lot in our hospital sector. My list is too long, thank you.
Thank you. Stuart.
When the party that started the P3 hospital things was the Mike Harris and Ernie Eves Conservatives. When they were out of office, there were 3 in the whole province. There are now like hundreds of P3 hospitals. We have the Royal Ottawa Hospital, which, as I said earlier, went from 230 to 180 beds. I know the woman that used to be the chair of the Health Coalition worked there, wrote a report that's on the OPSU list about how the management didn't have a clue how to run it. They didn't provide safety for the people working in offices and stuff. So is this going to be what's happening at the Civic? I hope not. We will ensure that it won't happen.
Mark?
P3s, I'll be honest, I don't really know too much about them, but so I'm going to approach it from the aspect, if it's a government service like OHIP under the LINS or under our government program for OHIP, then the people in the government of Ontario should provide the professional engineers to design, develop, put that out to bid, or bid it internally. Well, we don't have any of those carpenters and stuff like that, or very little of them left that we can do that. If we're talking about P3 and hospitals and portions of that being privatized, I'm not really sure if I'm in agreement with that. Yes, I agree from as a libertarian point of view that we need to find ways to cut costs to provide more services. If secondary services like laundry and stuff like that can be done cheaper, then I'm all for that because it provides more money to hire more doctors, nurses, and healthcare workers and specialists. So it's a double-edged sword. I'm telling you, I'm telling you my opinion. That's what I believe. If a laundry service or a cleaning service is not as vital as getting an extra nurse on the floor, then I think that that's a fair thing to say.
Still has merits.
I'm going to exercise moderator's prerogative, and we're going to go right to questions from the floor. So again, I'll run around with the microphone. Speak. You got 1 minute to ask their question. You can direct it to whatever candidate you like. Okay. The first question here.
Okay. I'll speak as fast as I can. I'm a retired social worker. I know all about discharge planning, waiting list, but I really think I really support the community health services. But I think it's also important. People want to age and die at home. Mm-hmm. And I think we need suitable housing for seniors. And they don't want to own a house. I really think co-op housing is important. And I really would like to see the government, whatever government, to commit to inclusionary zoning, put that, demand that from the communities. But I heard yesterday that it's up to the municipalities to decide. Well, we know that who is running the Ottawa, and that are the developers. And I know I have been very much involved with planning and zoning. It was hopeless with Jim Botson and Jen Harder. So it has to be demanded by the government.
Do you have a particular question?
And my question is, will you commit to, and I have more, but I have to stick to this 1 minute, to inclusionary zoning that it is imposed on municipalities? That's what I would like to see from a government.
Okay.
Sorry.
So on inclusionary zoning.
Inclusionary zoning. And include seniors in as a category.
Yes, and I think you were at the long-term care debate yesterday where Yasser Naqvi and I discussed this. And essentially what the Liberal Party has told the province of Ontario is that it's past the buck politics. They brought up their first inclusionary zoning model, which was 5% of new builds have to be affordable ownership housing. The definition of ownership defined by the developer and the cost for developing those units shared by the municipality. It was legislation written for developers. And then when the housing advocates of the city lost their minds and the Liberals pulled it, they came back with pass the buck. They came back with, oh, actually, we believe in empowering municipalities and letting municipalities decide. Well, you know what? Other provinces think differently. Where my family, you may find this funny, friends of mine in this room, I have uncles who are developers in Quebec. And if you build a unit of more than 100 units, In Quebec, you're required to set aside 20% of that unit for affordable rental housing. That's the world that developers have to work in across the river. Why not here? The NDP has set a goal of 30% because we listened to the housing advocates like Ray Sullivan and Catherine Boucher and others. And it can be used for seniors to make sure there are affordable places to live in these gorgeous condo buildings that are being built.
Housing is a key social determinant of health, so it's in the health file.
I want to address the first portion. I know that my colleague might have talked about that yesterday on a different debate, but I want to talk about the aging and home component, because that's very important. We committed to keep seniors for as long as possible in their home, and we're working very hard to have the human capacity to do this. So we've increased the salary of our PSW. We've worked very hard to hire and train more PSW. We're also, as we're doing this, introducing a new programs, and I want to talk about this because I know it's not in the NDP platform, but I am excited that we're going to be reinvesting in senior to help them, support them with some aspect of housekeeping and maintenance, hiring someone to prevent the fall from occurring. $750 every seniors over the age of 75 years old will benefit from this of this program. And when you look at the positive impact of preventing accidents from occurring, keeping someone in their house as they want to longer, I think it's key.
Okay. Stuart, on inclusionary zoning is the question.
We advocate social housing for 200,000 units across the province. That is been a long-standing policy of ours. It's probably, we need more now than that. I know the federal Liberal government just made a big announcement on housing, and over 10 years they're going to build 60,000 across the country. That's not enough. So that's to do an inclusionary zoning. I don't want it for developers get to build 45-story condos that they're doing. We'll make 5% affordable at the bottom. For people, part of the question is people want to live at home and stuff. Yes, I know that your friend of mine's mother lived at home. She had home care. Home care was put to competitive bidding by the Harris government. Victoria Ordinary nurses lost their jobs. Everyone got lowered, and then the Liberals tried to give some money to that system. What it is, the private owners took the money and never gave it to the workers. So we need a publicly run service.
Mark?
Yep, my communist friend is actually right. They CCAC in providing home care to seniors was a great program when it started, but it's been cut to the bone.
Yeah.
I have personal and intimate knowledge of this. I know lots of people. My wife is actually in this industry. And the problem is there isn't enough money, again, because of the rationing, because of the bureaucracy that's behind it, because they decided to close hospital beds and force people to drive for 20 minutes in between a wait time, spend 15 minutes with a client who really, really wants help, and they don't have it, because they don't have the money to do it. If you're asking me about that, that should be done in the hospital, in their home, properly funded. And again, the only way you're going to do that is if you control the funding and you make choices, and then your LINS network has more money. That's the only way it's going to change. I'm sorry, they can talk all they want and they can make you all the promises, but until you control the funding, until you are able to make choices and have that power, nothing will change.
Raphael?
Yes, a quick remark. Another big problem that we see in budget, we don't see seniors, we don't see any policy for seniors that is sustainable. And I've witnessed that in British Columbia, where they introduce program now that tackle retirement, because that's part of retirement. Our seniors must retire happily. And this is a huge aspect of retirement. And if we can provide a good retirement plan for seniors, then all those issues would be addressed.
Thanks. Okay. Okay, we got 1, 2, 3, 4, 5. Okay. I'll start right off here.
Hello, how are you doing, everybody? Thanks for organizing this debate for PSAC. I just have a personal experience. Last week, my wife had a cesarean at the Montfort Hospital, and she has post-polio, and so she's a person with a disability. And normally a woman doing a C-section would take they would keep them in the hospital for 2 nights, but she was clearly not able to to go home after 2 days due to the fact that you have to use a lot of muscles to get over the C-section, and that she doesn't have. We were told, no, you have to go. You must leave. I've been treated better at 3-star, 2-star hotels. Then I was given the explanation that, well, maybe the research has shown that if you stay in the hospital longer, you may get an infection.
Yeah.
So that was the explanation, and I was just really disappointed. Not disappointed in the service as much as I did in the actual, the fact that we had to go. It's just a personal experience that I'm just very disappointed. So no, I understand that. That's why I'm getting my question, but it all relates. So my question to all the candidates is, in this situation, what is your government going to do to prevent these kind of personal experiences to happen? Thank you.
Okay, I'm going to start at this end and go. And again, I'm going to ask you to really rapid fire so that we can get, there's a lot of people who want to ask questions. So let's move it along very quickly. Raphael.
Of course, I've heard similar experience, and sometimes I can relate to my experience back in British Columbia. We've had people die in the ER. They died there, and that prompted them to look at the issue more seriously to increase service delivery. Because if hospitals are looking at service delivery to increase how they deliver, not funding, etc., expanding ER, expanding all of their services, that will definitely reduce and eliminate those to happen. Because from example, we've learned that in BC, and they've taken care of that. So our government would commit to expand hospital delivery service. Once you expand hospital delivery service, this issue will never happen.
Okay. Mark?
I'm sorry, what was your name again?
Oliver.
Oliver, I'm sorry to hear that, because my wife went through the exact same thing. She went through the exact same thing when she got a reduction. She was kicked out of the hospital, oozing and bleeding, couldn't barely move her, had to lift her up and carry her into my truck because that was her allocated time. That was the allocated time that she had. She had to get out, and I literally carried my wife out of the Queensway Carleton Hospital and put her in my F-250. Thank God it was tall enough that I didn't have to bend down, because my knees and hips are bad. Now, that being said, the problem that your wife didn't get service is because there wasn't enough staff on the floor. Reduce the bureaucracy, give the people control of the money, hire people for frontline service delivery, or allow them to try private. I myself am 55, I'm an injured vet, I need 2 knees and a hip that I've been waiting for 12 years from this government, and I haven't got it. Veterans Affairs will even pay for it, but this government won't allow me to have it until age 60. And I won't lie on the 100-meter test that I can't make it in 3 minutes, and I won't lie to say that the pain threshold is more than 80.
Okay, Stuart?
Well, that's a terrible story to hear, and my sympathies for both of my children were born cesarean, and they want to out because they know there's more coming, and they don't have enough staff, they don't have enough beds, they don't have enough stuff because of the cuts to hospital services all this time. So we need to provide more funding, and we need to hire more people, and so that they're allowed to stay in the hospital for what you need.
Mary France?
Oliver, listen, I'm very sorry to hear about your personal experience, and my understanding is you're a new father, so congratulations, and I sure hope that your wife is convalescing well. It's always concerning when you hear those things, right? When someone is not able or feels not capable of returning home, and as a former social worker, discharge planner in hospital, those are the difficulties. And I know what you were said and personally shared about the infection is probably not what you want to hear when your wife is having a problem and you feel and you're having those circumstances. So certainly for me, every unique circumstances are unique in a sense that we need to work in a better partnership and in collaboration. So I think funding is always appreciated from a hospital perspective, and that's our commitment to fund operationally to help those circumstances. So again, congratulations on the birth of your new child, and I hope your wife convalescents fairly well.
Thanks for sharing your story. This is the consequence when you take $300 million out of a community over 15 years, and no amount of nice words is going to fix the hole that's been made. The only thing that will fix the hole that's been made in which patients and staff have to suffer is a massive reinvestment program, and that's what we prepared to do by asking the wealthiest in our economy to contribute more.
Okay, question. I'm going to shift over to this side. We'll go back and forth. Okay, right here.
Hi, I'm just reading. I'm not very familiar with all the statistics and that, but I do believe what the Health Coalition puts out very much. And the Ontario funding for hospitals was a whopping $540 per person, less than the average of other provinces. For Ottawa area alone, that means that there was a big gap of $500 million for the year 2017. Liberals, you said you put in $330 million. Well, you're still short just for the Ottawa area alone. So how do you figure, are you really proud of putting in $330 million when Ottawa alone is $500 million short? And can you promise to get that gap decreased and get us equal with all the other provinces?
So your question is to Mary-Thérèse?
Yes.
Okay.
I think it was directed to me.
Thank you very much for your question. So, you know, in the past few years, we've been working in partnership and transforming our healthcare system. So what I hear every time is patient first, better access, closer, proximity. But our hospital system has also seen that acuity and that sort of new perspective on an aging demography. And also, I have to say, sometimes just the rationale of people being sick as flu season, we've seen the uprise this winter and I believe last winter. So our commitment was to invest, and is to invest, a continued investment of new money of $822 million more all across the province. I have the number here, particularly for Ottawa. They were all announced earlier. In 16-17, we've increased their operation funding. In 17-18, and moving forward for 18-19 and onward, I have those numbers, and I'm more than happy to share. I know I only have 1 minute.
My question was, are you going to increase it to be equal with all the other provinces per person?
So what we're looking is a transformation in our healthcare. So for instance, in Orleans, we're building a healthcare hub. We're building a publicly funded model where people will have a closer access. Thank you very much.
Thank you, Mary-France. I'm going to go to another question over here.
I'm very disappointed that the PC has not shown up. The candidate, Dr. Marilee Fullerton in Canada Carleton, has proposed in the past private-public services in healthcare. I really wanted to ask the PC candidate how they would justify this.
Does somebody from the Health Coalition want to respond to in terms of efforts were made presumably to invite the PC candidate, but they chose not to show? Would you like to make a comment?
Indeed, they were. They were invited. We spoke to party headquarters. We were directed from party headquarters to speak with a number of individual candidates. We were not successful in getting somebody to come. So, but it's only healthcare, right? In some cases, there were conflicts. In other cases, they thought their time was better spent on the doorstep. In the case of some people. Yeah.
A quick comment, and I want to get more questions from the floor.
I'm not surprised at all that they're not here. You can name debates. There was a debate on women's issues a week ago. There was an empty chair sitting on the table, or on the stand, waiting for the Conservative candidate. I ran in the federal election in 2015 at the mosque. And I got invited, and then I arrived, and they said, oh, and there was an empty seat. It was a Conservative. They don't come for these things. But she'll be at the Colonel By Retirement Home on June 5th to speak to senior citizens. They don't come because they know that the people want the positions, and they know they can't answer questions from an audience like this who want to preserve social services.
Any other comment? Okay.
I just have a quick point. From the Ontario Libertarian Party perspective, owning the funding means making choices. If you want to try private or buy or pay for that Quebec MRI, we have no problem with that. There's only 3 countries in the world that don't offer some form of alternative health care, non-governmental services. Cuba, North Korea, and Canada. And why don't we have that right? And why don't we have that right with our own tax dollars that we pay in our tax for, to be able to access services that are capable for us?
Like in the US.
Okay. Other questions? I'll go right here.
It's working so well.
Good evening. I worked in the healthcare system for 36 years as an RN, just retired last year. So I've seen all the changes. And it goes back to Mike Harris in the 90s, who cut over 1,000 beds from Ontario. You cannot cut 1,000 hospital beds and not have a trickle-down effect. So people used to be able to stay in hospital, get better with assistance, go back to the community, and be safe in their own homes.
Right.
We now kick them out, like your wife. It's not because there isn't enough staff. There are people out there ready to work. There are not enough beds. They're just not enough to go around, so the ambulance staff can't offload. We have the lowest percentage population of hospital beds population in Canada. That's a terrible statistic. Would you commit to building more hospital beds? Because that is where the problem started, and it will not go away. The money never went to the community. The community is still starved. We need more hospital beds to relieve the trickle-down effect that affects every service.
You can't have beds and not know people working in them.
Okay, we've asked the question to come at you a number of times now, but again, any further comments in terms of building capacity in acute care?
The investment I announced earlier will build 2,000 beds. And that's going to go a long way to dealing with urgent care in our city.
So in 2017, actually, we've increased capacity in terms of beds by 1,200 beds. We are fully committed to increase, that was last year. So this year, we're fully committed to continue. Also, we made an announcement of 3,500 new nurses to be hired before the end of this year. At the same time as we're talking about a hospital, I was talking with my colleagues and a few actually of people at the door, and they were talking about the Ottawa Birthing Center. This wonderful location off Walkley that we created, that we've invested to. And they actually appreciated the fact that they didn't have to go to a hospital. That was a personal choice they made as to how they want to give life to their newborn. And that's another reality, right? So I hear what you're saying about the hospital, and we have to continue working with the hospital. At the same time, we want to provide a flexibility, a more easy access to other types of services in terms of healthcare access. So the Orleans Hub in Orleans, we're going to look at the Ottawa Birthing Center, and all aspects of our family health team, urgent care center. You know, there's a holistic approach of healthcare, and I really believe firmly that we have to look at that.
I don't know about the experience in North Korea, but I can tell you what I experienced in Cuba, because I've been there visiting a while ago. In each village, in each town, I was in a village, visiting a village where it was used to ship bananas up to boats of thing to go to the United States, the United Fruit Company. In each village, there's a health clinic and there's a school. And that's what's provided for all the people there. I, in fact, fell in Cuba, ended up in hospital in Santiago de Cuba. I was rushed in, no question. I got treated very quickly. Good health care system. Thank you.
Mark?
I can't remember the question, and I'm sorry.
Again, about the capacity.
I'm sorry.
More beds.
More beds.
More beds
Talk
simply,
about that.
you know my answer to that. My wife is a nurse, I understand your struggles. I know what nurses go through. I'm a stay-at-home dad for the amount of hours my wife has to work. You're not gonna fix the problem until you increase the funding, open the beds like this lady said, open the beds like you said, hire more staff. You're not gonna get that. You're not gonna get that in this. You might get some portion of it, but you're not gonna get all the money that they're talking about it. So you know my spiel, give the money to the people, let the people make choices. That's all I have to say.
Again, it all comes down to service delivery. And if we're going to resolve this issue, we need more service delivery. When's the last time we've seen a project that we're building new hospitals? When is that last time? No, but if we put $5–10 billion to cut the wait times, it's still getting worse and worse. And we have Premier Kathleen Wynne at 15 years, not only to address this issue, but to resolve it, and it's still worse, getting worse and worse and worse. When I left BC, I've seen 5 more hospitals expanding. And here, we're not saying we don't have enough resources. We have tons of nurses going to work in the United States. We don't have jobs for them because we don't expand. And once we start putting money to expand, build more hospitals, that's when we're gonna start improving our service and prevent people from what happened in the ER. Thank you.
It's 8:30. I'm going to take 3 more questions, and then we're going to do a wrap. So this woman here, and then this gentleman at the back.
Okay, excuse me. This whole evening has been spent discussing downstream approach to healthcare and a reactive response to healthcare. And there has not been a single word mentioned about upstream prevention. Could you please comment?
Thank you for your question as a former community health center. I'm going to start from this and go down this way, okay? And again, please be quick with your responses to get the other questions in.
In my introduction, I explained that my background is working with integrated medicine communities, and my approach is a holistic healthcare. My platform is healthcare reform. And if you look at China, they have holistic healthcare. They have a holistic component. And that holistic component can help prevent lots of preventable disease. They can prevent cancer. They can detect it at an early stage where you don't have to go for chemotherapy, etc., etc. So this is a very important issue that's what we're going to address, an holistic component of a healthcare reform that's based on preventable disease where people can lead healthier lives. And China is doing great with this type of system. It allows both the holistic and conventional system to work together. And it works fine. People are healthier and they can prevent some preventable disease. Thank you.
Mark?
Preventative medicine would be nice to be able to do if they had the funding to it. Doctor's office throughput people, emergency rooms throughput people, clinics throughput people as fast as they can. Because they just don't get paid to look after people. There's no money for that system. You know my spiel. The only way that Eastern Ontario LHINs will get richer is if the people control the funding and choose OHIP or any other type of service that they can. That's the only way that it will get better, is if the people control the funding. We need to get back to holistic medicine. That's what we need to, but we can't. There's not enough money for it. There's probably not even half a program for it out there. And if they would grow the bureaucracy and not fund it correctly.
Stuart? Preventive care?
Preventive care, I think we need to provide services for education, or people can use community health care centers to learn about how to develop an active, healthy lifestyle. I think you can do that in education by improving education, many different areas to do that. Funding, the one good thing that Stephen Harper did was provide a tax credit for children's health that's now gone.
Okay, Mary France?
I'm happy about your question, actually, because I do believe that we never do enough for preventing. And I have to be very frank, we look always at the hospital beds. That means that person has reached a threshold where they need that care. Long-term care, that means that we could prevent them from potentially staying in their home a little longer. So I know there's programs out there, but the importance of our family health team and our community health centers are a key component of addressing, and that's why we fully commit, and we're committed to increase capacity for them to work on programs. So we can be harm reductions, it can also be addiction and treatment programs, and it can be better outcomes for seniors. And we're looking at fall prevention. We are looking at, helping with your diabetes. I was at an event in Orleans where the local Orleans-Cumberland Resource Center was addressing nutrition for one person, and how is nutrition important and what can you do. Also, social housing is definitely a key element of ensuring that the social determinants of health are cared for. So definitely, can we do more? 100%.
Thank you for the excellent question. I'm very proud to be running on a platform for a party that is proposing a once-in-a-generation change to preventative health care through a universal dental care program. We are doing this because we're raising the funds required to pay for it, and what it will do is a lot more than what the Liberals have proposed, where children are given a $50 credit to go to the dentist every single year. It's absurd. We believe that it's crazy that 1 in every 3 people walking into an emergency right now have a dental-related problem that is metastasized and got worse. Seniors with abscesses in their teeth, particularly. So we are running on a platform, we're the party that brought Medicare to Canada. It comes from Saskatchewan. Because we believe in universal solutions, not piecemeal solutions. So we're running on universal dental care. We're running on universal pharmacare. We believe these things will help people, but they'll also take the strain off the primary healthcare system and keep people healthy. But we are prepared to ask the wealthiest to pay for it.
Now, there's a gentleman right at the very back. He said his...
Okay, well, thank you very much. I'm also a retired registered nurse. I worked at the Children's Hospital for most of my career, also at the Ottawa Hospital. And I worked in the neonatal intensive care unit. And in talking to my colleagues, I find that now they don't even have a nurse to admit into the neonatal intensive care unit. Wow. And CHIO is the highest level of tertiary care, and it deals mainly with surgical cases. So if a woman delivers a baby that requires that level of care, there is not a nurse there to look after that baby. So what they're doing now is they are going to their on-call list, they're calling in staff who are being called in a time and a half to try and meet the everyday needs. And when I was working there, we had a nurse who was able to admit, who had a lighter assignment. So my question is this: after so many years in charge of the healthcare file, how is it that only this year the Liberals are now coming up with a program to perhaps increase beds? This has been an ongoing problem for at least a decade. So I would really like an answer to that. Thank you.
This question has come up a few times now. Do any people here have something further to add?
Well, actually, I don't need that. I just want to add one thing as nurses. The RPNO and the RNO are the professional body in Ontario that regulates nurses. We don't have enough nurses. There's not even a standard for nurses to say how many medications can you give. My wife deals with this. I know lots of people that are given 70, 80 meds in a pass 3 times a day. There's no standards. Maybe if we had standards that we could actually hold to account the professional body and actually give a break to our nurses to be able to have a real chance to give primary care. And the RPNO won't do it. The RNO has not done it. Provide a professional level of care standard per person, especially when it comes to medication and medication error. And I would love to see that happen, because only then will you then have the justification to say, we need to hire another nurse.
True.
And using our plan, you'll have the money to do it.
Okay, quickly, Stuart?
And there were a lot of nurses in Ontario, but Harris laid them all off. What happened is that hospitals in the United States came and had the, hiring things, and off they went. So they haven't been replaced. We have people brought into this country who are from the Philippines, are trained as nurses. They end up as caregivers under the Temporary Foreign Workers Program. They should be allowed to come here, become citizens, and work in Ontario.
There's somebody at the very back here who put a question in my ear when I was back here, so ask your question.
Thank you. I'm a home care worker and I work in the community. So I work directly with seniors every day of the week. I've seen lots of suffering and no legitimate explanation for it. How many of you have sat down and really spent time in the community with your seniors instead of speaking to the professionals running at the table?
What's the question?
I have, and I really respect the work that you do for our seniors. Thank you. I mean, our campaign's knocked on over 35,000 doors. I left my job 8 months ago to throw myself at this. We knocked doors twice a day, 6 days a week. And through the winter, we spent most of our time in Ottawa community housing. And the seniors I spoke to felt fortunate to have rent geared to income housing. But what I saw is many cases, I mean, it gives me cold sweats to even think about it now. I mean, the amount of pain people are living in. Veterans, people who fought for and defended this country, grandmothers, people who've raised children in this country, living in abject poverty. And we need a crisis-oriented approach to this. As we do for the opioid emergency, which is going on in the streets of the city right now, we need to empty the 2,800 person list for home care that exists right here in the city of Ottawa, and an NDP government has committed to do that. We will absolutely do that, and we need your help. And thank you for your service. Thank you for what you do with our seniors.
So actually, 17 years of my life I've spent it in our community, helping and listening to seniors actually. And for the past 4 years, I had the great privilege of actually listening to families, families from long-term care, families from the home care system, and trying to build a better home care system. So certainly I was very happy when we've increased our rate in terms of paying you a fair and decent wages because of the service that you're providing to our most vulnerable seniors in our community. And we want to continue. So our investment, and I won't share the millions of dollar investment and everything, but we have a firm commitment to work with our PSW because you are key, very key in delivering the very, very important everyday services that seniors and other individuals in our community deserve and need. So certainly for us is to continue to work with your association and yourself in bringing higher wage, more support, and more of you.
Stuart?
I'm not someone who works in the healthcare sector. I was working in the university sector for 33 years. But I have a dear friend in Toronto who, his mother was, she was basically going through the last few years of her life. There was a home care worker there who came every day, worked very hard, and I mean, they deserve all the respect and things, and they need support. They need money. Harris brought in competitive bidding so that you get paid less and less and work more hours, and that hasn't been solved. So I can emphasize with you. Thank you for what you've done.
Your program exists because the cuts that they made to actual nursing jobs in hospitals, closing of long-term beds on both sides of the house, that's why it exists. It's not going to get any better until the people own the funds, obviously. When you think of our parents that were supposed to stay under the great NDP socialist rule that says that we're going to be taken care of till death, well, our parents are now paying to stay at home. They're now moving out of their homes and having to use their life savings to pay for their own health care. We were promised that health care. This is totally off tangent of a libertarian principle, but it really, really makes me mad that my parents can't do what they wanted to do in their retirement because they're trying to pay for their daily needs and living because of the cuts to the system. The cuts to the system aren't going to stop. They won't stop until you own it. They say people power change. Well, we say you own your services and can choose that. And a lot of people might not agree with me, but that means more doctors, more nurses, more PSWs, more staff to run that. And the only way it's going to change. Sorry.
Personally, I've worked with many groups that tackle seniors issues in BC, here in Ottawa, well, let's say Ontario. I've done a lot of research on seniors. There's issue, the seniors are over-medicated. Veterans Affairs, we have federal provincial money transfer where the budget is not allocated to properly take care of our seniors. We have a housing crisis for seniors. We have retirement income for seniors, you name it. A lot of problems that from top to bottom is not being tackled, and there's no policies. Of course, we hear promises that we're going to, but all those parties had many years to handle and resolve the issues for seniors, and it has not been done. And even violence against seniors now is on the rise. And all those have to be stopped, and from top to bottom, we need to see the federal, provincial government working in partnership to provide those resources to protect seniors in their retirement days. Thank you.
The last question is going to go over to you.
I would like to address the situation of the appalling conditions that seniors find themselves in long-term nursing homes that are run for profit. Okay? There's a huge amount of money being spent by the government. So it isn't, when I hear people talk about nursing homes, what I hear very often, well, if the government just put more money. No, the government puts a lot of money. They just don't get a lot back. They need legislation. Okay? It's not just the 4 hours a day. So even if you brought in 4 hours a day, that's a very broad statement to be making on a very specific issue, which is legislation, okay? And there are models. There's a model in Saskatchewan and there's a model in New York State that will describe what good care for seniors is in a long-term facility. So the bottom line is this. These seniors are neglected, and they're sometimes abused. And we're told that, especially with dementia, and I won't call them residents because they're patients now, but especially with those residents, they need emotional and physical stimulation, which they never get. So what I'm asking all of you is, what's going to happen to make the changes to these nursing homes?
Two in Orleans.
Last answers will go this way. Joe?
Thank you for the excellent question. So what we've committed to do, just so I'm clear, when I talked about 15,000 long-term care beds that we want to build within the government's first mandate and a goal of 40,000, that is to be concentrated in not-for-profit and municipal homes. That's what we believe. We think the Wettlaufer inquiry has woke us up to some serious problems, criminal cases in those cases. But we want to extend the Wettlaufer inquiry to the entire province, where we go from town to town and we do a find and fix inquiry, where someone like you and others who are passionate advocates in our community give us the answers we need to make sure that the systems run well. And I agree with what Stuart said earlier. The Harris government is the origin of this extended care, Rivera model of people profiting at the expense of shortchanging our seniors who languish in beds for 18 hours a day, develop bed stores that become serious problems later, and eat terrible food. We can't let it happen to us.
But how long are we going to blame my carers?
Yes,
like another
exactly.
10 years? Like,
It's-
okay, I get the point. It is my carers, but are we always going to be blaming my carers forevermore?
Well, you make a good point. I take your point. It happened when I was, in my 20s. But when you dig a big hole for yourself, from which future governments don't help us get out of, we have to have the government be ambitious and say we've got to contribute a lot more resources to fill that hole. What I hope I can persuade you of is that our government will do that.
Thank you for your questions. I think we've met a few times in the last 4 years in our offices in Orleans. So always happy to see you being a strong advocate for people who live in long-term care. You know, as I said to you many times, our commitment is to work to improve conditions for seniors, right? I was on the Council on Aging before my political years when it came times to ensuring the safety and the well-being of our seniors. And certainly for me, it's always been, I do agree with you that there is an aspect where we need to stimulate them. We need to engage them more. We need to have maybe more recreation therapists in our home to, you know, create those activities and keep them busy. Having also individuals, so I know we talk a lot about nursing care, and we are fully committed to do this, but I understand a multi-professional approach of caring for someone. So certainly we always want to work with people that believe in our system, and we will continue.
Stuart?
I brought up my parents a few times, so I'll try and
Yeah.
move on that. No, but you've seen stories in the Ottawa Citizen about, you know, bad services in hospital where patients are abused. We had a woman who fell out of a just a month ago.
Yes.
It was at a private health care, long-term care, where they'd already been getting advices by the ministry to shape up. Well, they don't do it because they put the money for profit, not for that. So our commitment is to build 30,000 beds for long-term care in public care because they run better. Are you going to use it?
No. Let's differentiate between LTC, long-term care funded by the government and municipalities, and retirement homes. Retirement homes are for-profit. Both standards of care have the Ministry of Long-Term Health come in and do audits. Both actually have good audits, have bad audits. The big difference is the private facility is accountable to the people and big, huge fines. The difference between an LTC is most of the places that Shirley Mosley always posts on my page every day, Mark, what are you going to do about this? Our own government-run facilities. And the reason why they're having problems is aging buildings, aging infrastructure, understaffing of the positions that do not give enough time for the staff to do their job, nor to be able to interact in a humane manner with the people they are charged for caring with.
Yeah.
We need to increase that funding. I'll go back to my spiel. You know my spiel. That's the only way it's going to change, because they're not going to change it.
Raphael?
Yes, and I absolutely agree with you. It starts with legislation, introducing sustainable legislation that tackles the real problems that seniors are facing. Because we're not tackling the real problem that seniors are facing. And in terms of private care for seniors, we have an approach to build projects where they can be governed, they can be publicly funded, not leaving those institutions at the mercy of the private sector. The government must step in, and we need to see provincial and federal government partnership created to address these issues in terms of legislation and funding. And I absolutely agree with you. That's where it starts, with good legislation.
Okay, we're now in the final part of the agenda. We're going to give each of the candidates 2 minutes to make some summary comments, and then we'll conclude and I'll throw it back to Benedict. Okay, so we're going to start at this end and we'll go. So Raphael, your concluding comments, 2 minutes each.
Thank you so much. It has been a great pleasure to listen to all of your concerns, and that's what we need to open dialogue. And today I realized a lot, and my experience has led me to understand what really needs to be done. We need to not, stop making promises, electoral promises that sound good, they're not gonna work, and tackle problems with legislation. And that's where it starts, government stepping in, and if elected, I will take all those comments, all those issues into the Legislative Assembly and introduce proper legislation to protect our healthcare system, to ensure that the funding goes where it's supposed to go to service delivery, to introduce healthcare reform where we can have a system that has a holistic approach to prevent disease. Once we prevent disease, we can help people lead to better lifestyle and also reduce the burden of taxpayer spending on healthcare system that is not working properly. I don't believe in increased taxes to raise funds to pay for our public system. I believe in allocating the spending properly to service delivery, where we can have good services that is focusing on the patient first. Thank you.
Mark?
2 minutes, wow, I don't know if I can talk that long. I actually agree with some of the stuff that you said tonight, and I really appreciate your insight. And believe it or not, I actually agreed with some of the stuff that he said about the total socialistic control, but he's right in some cases. But the reality is, I love debate and I love good ideas. I don't care where they come from. I'm happy to be here to have the democratic right to be able to talk about our ideas. I'm a veteran. I earned that right.
Thank you for your service.
Hear, hear.
The biggest thing that we need to do, and we need to fix the problem. I mean, we can talk about it all day long, and you know, I'll go back to my spiel. The only way it's going to be fixed is if the people own the funding. If you own the funding, if you have control and choice, then you can make decisions. And yes, we're going to offer private. We're going to offer that. People to be able to have that ability, like they do in Quebec, like they do in BC, like they do everywhere else. If you need an MRI, you don't have to wait. If you need to see a specialist, you don't have to wait. I'd gladly pay to find out what this is in 2 weeks. Now, the point that I'm making is that all the promises that they made and that he's making, I get it. I totally get it. It's an election campaign. They're going to sell to you what they can sell. We're going to sell to you the power, the choice, and the control to be able to control those funds, both in education, both in healthcare, and you're going to be able to make choices. That's what the Ontario Libertarian Party is selling. We're selling people-powered choice with government funding. We love government services. I know that's anti-libertarian. We don't mind having any other kind of private service that would go along with it. There's no reason why they can't exist together. We're the only country that, besides Korea and China, that don't have it. You know, some form of ability to go get this checked or get a private knee replacement. That's what I'm talking about. Yeah, we can turn the page and we can have an election, but this is what we really need to talk about. If the people own the services, it's your tax dollars. Why don't we own it? Why can't we make choices? I don't like them telling me when, where, and how I can get my service delivered to me. I want to be able to pick a system that works for me. Thank you.
Stuart?
It's so small, Mike. We have a challenge to the Medicare system by Brian Day and Canby in BC, where he got caught double billing and not only his patients and also public service for the same service. And I hope that any government in Ontario will join the intervention to oppose that bill. So much for Brian Day. This is a very important election because, as they bring up Mike Harris, we have Mike Harris too in the Ford Nation. You know, for the people is with his corporate tax cuts, is going to have less money to provide the social services we need. The first person who suggested Medicare in Canada was Norman Bethune, who was a communist doctor who was servicing the poor in Montreal. We not only support public Medicare because of his legacy, but because it's a pillar of our policy for demanding a people's alternative. All our other things such as dental care, pharmacare, social housing, living wage, full employment, provide a healthy, prosperous people of Ontario. We demand a people's alternative. It's what the people of Ontario deserve. On June 7th, vote communist. On June 8th, come and support us for any or all of the policies that we do. We're prepared to work with anyone to provide a people's alternative. Thank you.
So tonight you had the opportunity to hear about each party, to the exception of our PC candidates, for healthcare in Ottawa and Ontario. Healthcare is Ontarians' #1 concerns, and I'm proud to be part of a party that has taken a deliberate decision to continue to invest in the people and in their care. Make no mistakes, PC will cut. PC will put forward a regressive agenda in the name of what Doug Ford sees as being efficient. I welcome many of the policies and some of the ideas, but mainly policies of our NDP platform here that have most of them been implemented actually by our party. One aspect that the NDP has not done, and that's something actually very important to me, it's $1 billion investment in prevention. It's actually what we will call our Seniors Healthy Home Program, which helps seniors 75 and over live more independently. And most importantly, they have no plan to strengthen Ontario's economy, which support our health services, and we depend on. Ontario's Liberal is investing in healthcare in Ottawa and will keep to meet the growing needs. So, capital investment in the Orleans Family Health Hub, the stem cell program in the Ottawa Hospital, the cardiac life support services redevelopment in the University of Ottawa Heart Institute, 8 family health teams, more long-term care beds, 5,000 over the next 4 years, including over 700 for the Champlain Linds. Home care services for seniors, increased funding for our hospitals, OHIP Plus for seniors, dental care for seniors. Ontario Liberals have a plan and a vision, and we will increase to care for all. I believe that we can do this together. I believe that we have a plan, that we can work together in a very collaborative way to improve our healthcare and the life of all of you seniors in our communities. Merci.
Okay, I'm going to take your advice and not snipe on the past. I'm Mike Harris and on my colleague. We've done enough sniping tonight. I started getting more optimistic about politics in the mid-1990s when I met a couple, and their names were Jack Layton and Olivia Chow. And what they showed me is that it is possible to have a better society in your head and every day of your life lead with hope, lead with positive policies, and move your community forward. That's the choice we're going to have in 2 weeks. Not spin, not we're tired of the blue team, let's pick the red team, we're tired of the red team. I'm talking about visionary investments. And my colleagues said they've already implemented most of them. I look forward to that happening in the next few days. Given that you're not in a city legislature, I don't know how it will happen. We will implement universal dental care. We will implement universal pharmacare. Can all the healthcare workers in the room put their hands up, please? We will respect you in collective bargaining. And for those healthcare workers that are not yet unionized, we will put a fair labor relations system in place so you can unionize. And you can get better respect from each other. This is, I think, what sets me apart in tonight's discussion. I don't want to be in a situation where we're talking about rationing existing public services and piecemeal approaches. I want to bake a bigger pie. Because you know what? Ontario does not have a wealth problem. Ontario has a wealth distribution problem. The 2 families I spoke about before are being, one of them, the Westons, Loblaws, is being sued for $400 million by a bunch of bureaucrats in Ottawa for a tax haven they created in Barbados by taking money out of Ontario and plopping it there. I rely on my friends in the Public Service Alliance and the Professional Institute of the Public Service of Canada and CAPE to help us recover those ill-gotten gains so we can put that money back in our healthcare system and our education system where it belongs. You need to vote NDP on June 7th to help us do that.
I'd like to thank all the candidates